Carbidopa Levodopa is the generic medicine. Brand name is Sinemet. Carbidopa Levodopa is the generic medicine. Brand name is Sinemet. Sinemet is a medication used to treat Parkinson's disease, dystonia, sleep-related movement disorders, parasomnias, and restless leg syndrome. It is the most commonly prescribed medication for Parkinson's disease, and it consists of two drugs, carbidopa and levodopa. Levodopa acts as a dopamine precursor and crosses the blood-brain barrier to increase dopamine levels in the brain, while carbidopa prevents the breakdown of levodopa in the blood. The recommended starting dose of Sinemet is 25 mg of carbidopa and 100 mg of levodopa taken orally 3 times a day. The dose may be increased by 1 tablet every 1 to 2 days, up to a maximum of 200 mg of carbidopa and 2000 mg of levodopa per day. The dosage must be determined by careful titration in each patient, and the dose should be tapered gradually when discontinuing the medication. The most common side effects of Sinemet include jerky muscle movements, muscle contractions, nausea, headache, dizziness, low blood pressure, sleep problems, strange dreams, dry mouth, vomiting, and constipation. Rare but serious side effects may include dyskinesia, orthostatic hypotension, syncope, sudden sleep episodes, depression, hallucinations, and psychosis. Abrupt withdrawal of the medication may also lead to neuroleptic malignant syndrome. Sinemet is contraindicated in patients with hypersensitivity to its ingredients, psychosis, angle closure glaucoma, hepatic and renal impairment, severe cardiac and pulmonary diseases, peptic ulcer disease, and gastrointestinal bleeding. The medication should be used with caution in patients with renal impairment, and the dose should be reduced by 50% in patients with a creatinine clearance of less than 50 ml per minute. Routine monitoring of complete blood count, liver function tests, intraocular pressure, and cardiac function is recommended for patients taking Sinemet. There is no human data available on the safety of Sinemet during pregnancy and breastfeeding, but so far, no teratogenicity has been noted. The medication's mechanism of action is levodopa, and it is unknown how it affects CYP450 enzymes. Approximately 70–80% of the medication is excreted in the urine, whereas as very little is excreted in the stool. It may darken the urine color. The half-life of Sinemet is between 0.75 and 1.5 hours.